all aware, it's all about testing the communication as well as your knowledge. But the most important thing is, it's a time-framed exam where you have 2 minutes to read the instruction and 10 minutes to perform the task. You have to perform 14 different tasks, which could be the combination of patient-simulated task, structured discussion, as well as a teaching task. These 14 tasks could be based on each 14 module, or majority of the times, mostly it's a combination of the modules. If you have given part 2 or if you have cleared part 2 exams, you know how much theory has been tested there, including the factual recalls with the tricky EMQs. But part 3 is all about how you are going to consult your patient in those 10 minutes given with the empathy, sympathy, and the shared decision making. As well, your examiner is looking at how safe a doctor you are. And in structured discussions, the examiner would be looking at, as a consultant, can I give this case to you? I mean, or probably a candidate who can be safe. The marking system is quite easy, I must say, because as candidates, we all think we must say all the points in the guideline. But when you look at the marking system, it is a customized management, it's a customized history, it is the most important basic vital things which the candidate miss. Is it because they don't know? No, it's purely because of the stress which is so overwhelming in the exams. The marking systems are completely based on the domains. You have 5 domains, but max to max 3 to 4 domains are tested in each task. And you would be getting pass, borderline, fail in these domains. And as well, there is a critical asterisk point per domain. If you miss that, then that domain is automatically fail. So this is a complex compilation of the marking system which gives a result of pass or fail. As well, there is one more element which adds probably a difference to these exams, a lay examiner task, which is the highest scoring one as well as the most trickier one. Lay examiner task is all about the stations where you have to negotiate, you have to convince, you have to take the consent. Such stations, the lay examiner would be looking at you as a second patient to understand how well you are talking to the patient, how non-judgmental you are. And you will have 4 such tasks in the exam, and you wouldn't even be knowing which task is the lay examiner task. This is where candidates struggle to understand which one I need to do as lay examiner, which one I need to think of patient-simulated tasks, and what are the difference between these, what vocabularies we can use. Structured discussions are progressive ones. It is not like one question. They would start you with the history, they give you the investigation, then you are supposed to be talking about the management. The problem is you cannot go back to the previous question. Structured discussion, if you have to answer, you must be thorough with the knowledge of that, as well as you need to use a couple of buzzwords which gets the marks more than other candidates. Being practicing clinicians, it is very difficult to get the time and energy and the money for these exams, because you need to practice. You need to practice in the right frame of mind, in the right direction, with the right partner, with the proper timing. Of course, you have to be assessed day by day to understand which direction you are running in. So if you're somebody who is looking at a structured, revised day-to-day plan where you are going to be assessed every day from the mentors, where you are going to give every day there is this pass, fail, borderline for domains, for the stations you have done, for your communication skills, for your non-verbal communication, then you can opt our courses where we do every day we are expecting you to send your audio or video where we'll be assessing. And the feedback is so detailed, which will help you to do well in the exam. It doesn't end there. Practicing only doesn't end, because you need to balance between the knowledge and the practice. So we would be providing enough summaries to go through and to plan the customized management for the different tasks which you will be getting. And in the sessions, you will be presenting just like the exam. So with all this daily practice, with all these sessions, with the mocks, and of course, if you could attend our live mocks, that's an exam before exam. And we have been doing this last decade, and I do understand where the candidates do errors. The most important thing, which I want to tell all of you, is you should know your strengths and you should know your weakness as well, so that you can work better. If you can identify that on your own, perfect, but majority of the candidates cannot do that. So if you're somebody who would want to know more, if you want to understand further about how we run these courses, how we have helped so many candidates to clear these exams and achieve their dreams, get in touch with us. We are happy to help. Click the link below and get in touch so that let your final leap be successful and let your dream come to reality. I wish all of you success in the upcoming exams, and I want to see all of you attending the convocations. If that's your dream as well, please do get in touch. We are happy to help. Thank you.